My name is Dr. Michael McKinley, and I'm a physical therapist at Progressive Physical Therapy and Rehabilitation. I'm also an ASTYM certified clinician. What I want to demonstrate today is how ASTYM works. ASTYM's been developed over the last 10 or 15 years, and it's one of the most effective treatment plans for any chronic tendinitis, tendinosis, bursitis problems that you may have. The way we administer, you use the tool, is we put cocoa butter on the skin to create a lubricant between the tool and your skin. There are a variety of tools depending on what we're treating. Today we're just going to use the medium-sized tool so I can demonstrate. The lubricant or the cocoa butter is applied and the tool basically slides right over the skin. Now what it's doing is it's catching onto the deep fibrotic or scar tissue below the skin in the muscle and breaking that down. We work in a very specific pattern. We don't just go wherever we want. We follow the direct line of the muscle fibers. That way, if there are cross sections or parts of the scar that go across the muscle that inhibit its function, they will break as the tool comes up and over it. If the scar tissue adhesion is in the direct line, nothing will happen and it will maintain the integrity of the muscle tissue. What happens over time with repetitive use injuries like carpal tunnel, tennis elbow, golfer's elbow, patellar tendinitis, Achilles tendinitis, or even bursitis, whether they're in an acute phase or a chronic phase, what happens over time is that scar will form deep inside the muscle or the tendon tissue. And scar, which holds our body together and is crucial for us to be able to function, it gets laid down excessively in our body. So rather than staying in a perfect alignment with the muscle tissue, it goes across the muscle. And if you can imagine, when it's inside that muscle, it'll pull it all together. So when you're trying to write, use a mouse, play tennis, or whatever with your forearm, the muscle is bound together, so its strength and its function is inhibited. Conventional stretching, something that you may have seen before like that, or maybe you've gone to therapy before and they've worked it out by hand. If you look at the edge of the tool, opposed to my thumb, it's a much finer edge than my thumb. Breaking down tissue is significantly faster and more effective rate. We have found over time, since we've introduced the tool over the last 4 or 5 years, that we're cutting down the number of visits by probably 1/3 by using the ASTYM tools. Once that fibrotic or scar tissue is broken down within the muscle tissue, muscle has fantastic memory, and its function and its strength will come back very quickly. We don't have to do a tremendous amount of strengthening to get your function and your strength back once the scar is broken down. If you've had this problem for a long time, even into years, and you've had tennis elbow, medial epicondylitis, lateral epicondylitis, golfer's elbow, rotator cuff tendinitis, patellar tendinitis, shin splints, runner's knee, hip bursitis, Achilles tendinitis, ASTYM is literally a breakthrough in soft tissue mobilization. It can effectively treat these problems even if they're old and you have failed in the past. If you have any questions, please give our office a call. We'll be glad to talk to you. Look more on our website. Look up ASTYM itself. It's a very effective tool.